The 5th of March 2020 changed South Africa forever. It was the day the first case of COVID-19 in the country was confirmed. The pandemic has changed the way we live, work, learn, play and even love. Let's discuss the impact of the virus on mental health with clinical psychologist Samukelisiwe Mthembu. Thank you very much, Ms. Mthembu, for joining us here on eNCA. Of course, I think it's been a roller coaster, right? Because we started first at level 5, the hard or harsh lockdown. Then things would open up and we think that life is getting better. Cases would spike, come back down. We think things are changing. What have you seen in terms of people perhaps coming to your office because of psychological problems?
So there's been a very big impact on the general psyche, I think, of the world and the psychological movement of mental disorders and people building certain mental disorders they didn't have, addictions increasing as well. But there's also been a lot of positive where people have actually started to invest in a lot of self-care. People have actually gone outside, gone for walks, and started realizing the importance of just being outside, being with family, spending time with family. So it's been both negative and positive. But also, the negative has been very bad in terms of mental illnesses and just the general clinical picture people have presented with.
Have you found yourself having to deal, for instance, with more couples who are facing problems because of the lockdown? We found out earlier from some lawyers that they actually have had more people coming to them for divorce, for instance. Have you found yourself having to deal with couples that you had to speak to about wanting to separate because of the lockdown?
Yes, not only just couples, just family discord and conflict in general, but yes, definitely there's been an increase, and you also, if you look at the statistics for the gender-based violence, that increased during the period where the lockdown occurred and during the brief period where alcohol sales were allowed, and again, people were drinking and then abusing their spouses. So yes, couple inquiries have increased, but also again on the positive side, those who have worked through the lockdown, couples who have spent more time together, quality time getting to know each other during spaces of confinement, has also been a positive thing. But I think the lockdown just only exacerbated what was already there. So in general, people do have a lot of psychological problems that they don't really talk about, they don't really confront until there's this negative catalyst. Because the lockdown could have been a catalyst for positive change, but also very much a catalyst for negative change.
So what are some of those positives that you can tell us about that you have, for instance, advised some of your clients when they come to you feeling depressed? It has been a very depressive year with people dying around us, of course, people losing jobs, having to close their businesses. What are some of the positives that you can advise us to walk away with?
So I think it's just once you get to know yourself and once you get to know your partner and once you get to know what stresses and triggers trigger you from your work environment, what kind of stresses trigger you in the home environment with children, is their extended family living with you, what are the boundaries that are not set between the in-laws and the grandparents and then that impact the relationship. Is the relationship the real problem, or is the relationship just the outlet for where the real problems are taken out on? So I think once you can find the center and you can pinpoint where the issues are coming from, that then can start bringing in positive change of actually working on something that needs fixing.
And of course, there was also the financial impact that this year has had on quite a lot of families. Of course, some of them have found ways to, for instance, find businesses that they can, do in order to have some kind of income. In terms of that, financially, the financial aspect, can you tell us anything that our viewers can take home with them in terms of advice about the financial aspect of this year being so difficult?
Something I'm hearing frequently is that, the way that money moves and the way that we work is changing. The 9 to 5 day, the 8 to 5 day is changing, and it's actually probably for the best, because psychologically it's actually good to take breaks in between work, or if you feel like you're more comfortable from working from home to make money. That has been something that we've seen people get comfortable with. Then you get the others who like going to the office and they find relief in going to the office. So financially, I think the COVID made people think outside the box, and it also made a lot of people realize that some ways of working are not conducive to psychological health, and also not conducive to financial gain for the company, and also not conducive to employee wellness, which then again lowers the profits of the company if the wellness or the general wellness ethos of the employees is not okay. So a lot of innovation has actually been birthed during the lockdown. People starting their own startups, finding ways to make money without having to necessarily be at the office or work a 9 to 5 job, especially for those, unfortunately, who have been retrenched or had been retrenched and were able to receive some kind of money from their loans or from banks or certain organizations that were giving pockets of money to certain people or small businesses. This is unfortunately not for everyone, because a lot of people need to know how to apply for those things. So for those people who were retrenched from certain companies, who were comfortable in their jobs, it's actually been a very difficult psychological time for those people.
Samukelisiwe, it's also very important, and you touched on it a bit earlier, not to only look after your mental health, but your physical health as well. People have, for instance, been told that they gained weight because of the lockdown, but some people, like you're saying, learned how to exercise, take walks. Hikes was at some point very much in fashion during this time, in order to keep yourself fit.
Yes, I'm one of those people that gained weight during the lockdown. And I didn't even stop working. But now that, all the levels, I'm one of those people who have also increased, like walking outside, just enjoying nature. And I think, when you kind of hit rock bottom, because lockdown was rock bottom for a lot of people, it's either you can sink into a depressive bout or actually start showing some inherited genetic mental illnesses. And that actually, in a sense, it helps people seek out help, and then they can start working on their real issues. And sometimes then it can be very difficult for people to get up and go, and that's where the mental health and the staff is there to help. But the important thing is that people do actually have to reach out for help and take accountability and learn how to just take something that has been quite a very difficult time and learn to let it, in a sense, turn a coal into a diamond, that pressure, and eventually learn how to move forward as we all try to move forward as a nation.
All right, thank you very much for your time here on eNCA. That's clinical psychologist Samukelisiwe Mthembu.